Okay, so now I need a volunteer for this. Let me show you. I need a volunteer, please. Oh, Hafsa, you've seen me for the first time. I want you as a volunteer. Are you still around, Hafsa?
I'm around.
You can unmute. You can unmute yourself. I'll show you the screen. Okay. Okay. Now I give you 2 minutes to be ready, and you will have to do this in a maximum of 4 to 5 minutes. I'm bothered about what are you going to say. Okay. But in exam, practically for this thing, you will have actually 3 minutes hardly to answer this aspect. But I'll give you 5. Read this, and I'll ask you in 2 minutes to start talking to me. Let me know if you're ready before 2 minutes.
I'm ready.
Okay, I'm Lisa. You can start talking as if you are in the middle of a consultation. Don't need to start like introduction and all that. Just start talking. Okay.
Lisa, I've read from your notes that this is your 3rd pregnancy and you are 37 weeks gone today. Is that right, Lisa?
Yes, doctor, you're saying that you want to admit me for inducing my labor, but why? I mean, I had shoulder dystocia before as well. Went well, nothing happened, no problems. Why are you worried?
Okay. We are worried because the previous shoulder dystocia predisposes you to another shoulder dystocia. And it is better that your delivery is planned, and we have the very senior doctors around when you want to deliver. Because if we wait for labor to come on its own, your baby will continue to grow bigger, and you could come at a time, you could come in the middle of the night, and the risk of shoulder dystocia occurring is high. So if it occurs again, we may not have the very senior people at that time to help you. And the longer the delay, the more dangerous it is for your baby. The good thing is that,
doctor, what danger? What's the danger?
Yes, the dangers of difficulty in delivering the baby. Your last baby, we were able to deliver the baby successfully, but if it occurs again, there could be more difficulty in delivering the baby. So it's better your delivery is planned, and we await shoulder dystocia.
Doctor, let me stop you here. My problem is that my last baby, she also, they said her shoulders were stuck, but they delivered her in like less than 2 minutes, and everything was fine then. So I don't understand what's the fuss.
I understand your concerns about this, but the concern that we have is that if your baby would be getting bigger from now on, if your pregnancy continues, and also if your pregnancy is not planned, there could be more difficulty at delivering.
And what can happen? What more difficulty?
If your baby's shoulder is stuck in, there could be injury to your baby, and there could be your baby's heart pattern could become stressed at that time, and in some cases it could be as bad as baby coming out, not responding, having convulsions at the time of delivery, and some babies have died from shoulder dystocia with
Oh my
difficulty.
God. Okay. Oh, okay. I just thought that my last baby was same, but she delivered. But okay, okay, doctor, thank you.
Oh.
Yeah, I'm okay then to follow your advice. Okay, okay. Anyone else wants to try this as well? Please come forward. Do you want to do this? Usha or Poonam, do you want to do this, girls? I want to see how do you attack this.
Yes, Dr. Sam, I want to try it.
Usha, okay, go ahead. I'll give you 2 minutes to think on that.
No, I will go straight with.
Okay, okay. I'm Lisa. So, and you are in the middle of the consultation, so just don't need to introduce.
Okay.
So doctor, what's the problem? I mean, what's the issue?
Yeah, I can
You're
see.
saying that I need to be admitted and included. I don't understand why.
Yeah, I really understand this is making you a bit disturbed. But the reason is I am aware of that you had a shoulder dystocia in your previous delivery. Is that so?
I did, yes.
Yeah.
And my daughter is fine.
Okay, yeah, that's very good. You are very lucky your daughter is fine. I'm really happy to hear that. And may I know what was the weight about your daughter last time?
Doctor, she was, they said 4.2 kilos.
4.2 kilo, okay. And so after that, you had a shoulder dystocia. Yeah, you are aware of that. In this pregnancy, what I can see from your reports, your baby is growing a bit faster that we expected at this stage of gestational.
Yeah, but you're saying that she will he will have shoulder dystocia as well. But what happens? So what? I mean,
yeah. So yeah, the reason is because baby is growing bit faster. If we let it baby grow more, then it will be no problem during the delivery, because the last time baby weight was 4.2 and the evidence shows you are having. May I know a bit more about your condition? Are you having any diabetes or any
no diabetes, doctor.
No diabetes. Okay. So during labor, if baby is bigger, then the problem again, because you had a shoulder dystocia before, so this time is 10 times more chances of shoulder dystocia. And as baby is growing more and more, and because of we will find out the what could be the key cause. Maybe I will check about. Are you aware of you had a diabetic check last time?
Yes, that's fine. I'm not done.
Okay. So like a shoulder can stuck again, this time is 10 times more chances. And then the nerve injury can, and high chances of you may have a heavy bleeding after delivery. Yeah. Okay. So for these and the one more thing, that I'm not scaring you. Sometime babies the afterbirth may not supply enough food for baby, and in that situation baby can die inside food. And so that we want to deliver before, because that is the safest, safe for you and for baby.
Oh, okay. Why would the blood after birth not supply my baby?
Because a baby is growing faster. Baby is need more and more. The speed baby is growing, maybe after birth may not be enough.
Okay, doctor. Okay, so you think that I should get admission and induction, yeah?
Yeah, that is the safest option we want.
Okay, thank you, doctor.
Yeah.
Yeah, I can follow your advice then. Okay, thank you. Anyone else as well, please? Any volunteer?
If you allowed to, if the pregnancy is allowed to progress, the weight can go even up to 5 kg. If it goes to 5 kg, as per the guidelines, we have to offer you cesarean section to prevent the side effects of shoulder dystocia.
Okay, Manikam. Manikam, yeah?
Yes, ma'am.
I can see your name and I can recognize your sound, Manikam. So yes, Manikam, absolutely. If we let the baby grow, it will be more than 5 kg and we will require us to offer you a section then.
Yes.
Good. Anyone wants to try this whole set again?
Can I try, Dr. Sam?
Okay, go ahead, Sam. Okay, doctor, why are you advising me admission and induction? And what's the problem?
Yes, Lizzie, I will explain you that what is the risks behind that. Okay, so and after that, after giving you all information, whatever decision you'll take will come to an informed decision plan. How does it sound?
Yeah, sure, doctor.
Yeah, so I can see that your baby weight is 4.8 kg, and you have before also you have shoulder dystocia, your previous pregnancy delivery, and also there is a the BMI is high also. Okay, so all of these risk factor, it will make you during delivery that your baby could be that there is a chance that 10 times the more that you may have this shoulder, baby shoulder could be stuck during
But
delivery.
doctor, what I'm saying is that I had this in my last delivery as well, and there wasn't any problem. I don't understand why are you guys making such a fuss of it.
Yeah, because first when you had this shoulder dystocia, so you know that at the time you don't have any history before that you had shoulder dystocia, but you have already now, so there is a chance that 10 times more you have this shoulder dystocia again. Am I clear?
Okay.
Yeah, so that's why we like you to be a safe side for you and for your baby. So that's why we like to deliver you earlier than that. As your baby is growing fast, then it will be difficult for you to deliver, and you need more intervention. Yeah, and it will injury to your baby, nerve, and also that baby could be even die if there is any problem arise. Okay, and for you also there is a risk that your if baby is stuck, then at the time need more intervention, that again you will go this additional maneuver to deliver the baby if there is a baby shoulder is stuck like before. Am I clear?
Okay,
Yeah.
doctor.
Yeah, there is an increased risk of bleeding also, increased risk of tear in your perineal muscle. So all of this, the risks which I want to mention you, then you can take an informed decision plan for your delivery. Am I clear?
Okay,
Lizzie?
doctor.
Yeah. So, so this is the reason that we like to deliver you before that, and we'll give you the medication which will make your neck of the womb open and to make contraction, as instead of that to wait for natural labor.
Okay.
Am I clear, Lizzie? So
Okay,
what do you
doctor.
think? What do you think?
Yeah, okay.
Yeah.
Fine.
You can take your time, Lizzie. I'll give you the written information, and you can, even though I can arrange another appointment with my consultant, you can discuss with him also as you like, and you can take your time and then let us know. Yeah.
Okay, can I decide next week?
as soon as possible, if you take decision, it is better for you, because as baby is growing fast. But in the meantime, if you feel there is any reduced fetal movement, if there is any pain, bleeding, or you there is a water broken down below, you can contact with us. Okay, I'll give you the contact details also. Okay, what do you think?
Okay, doctor. Yeah.
Thank you, Lizzie.
Thank you. Okay, so yes, good girls, every one of you tried. And from Hafsa, Usha, Manikam, and Salma, all of you have attempted. I think you were not all of you were, of course, ready that I'll present to you such a task. And slowly, as we progress, people started remembering more things. What I want you to remember is that these kind of questions in the exam, they will come just like that. And in that one moment, you have to be ready. And the best way to be ready for these kind of things is that to be ready at home before going in, before entering the exam. Yeah. So when you are looking at a station, I want you to imagine all the questions that are possible, and try to write the points there. Make a chart. I shared a kind of bubbles chart with you guys once, and I think if you look into the file section of the group, you'll find that I always encourage you to think in bubbles. Think of all the possible questions, and in those bubbles, if you can put the questions there, as well as then try to answer in points. Okay, you don't have to remember templates, just the points to say that, what are you going to say. This is a patient. I'll just sum it up. I'm not scoring anyone here. Okay, that's not the purpose of this exercise. The reason I asked this question here is that this can confuse so many people. You have to be very organized in your head about this. She's saying that she has a previous history of shoulder dystocia, and it was all fine. Yeah, and all you need to do here is that Hafsa, you did very well by telling me, what can go wrong. Usha, you did even better thing by, asking about the daughter. That was a good thing. That was one of the best things. Yeah. So well done, Usha, on that you asked how is the daughter, and I'm so happy that she is fine. That is important. Okay. Now saying that all the points were very valid, that Manikam's point was very valid as well, that if we let the baby grow, baby would probably go above 5 kilos, and that can be a problem. Even Salma's point that when you see kind of a negotiation is failing, or I don't seem very happy and very convinced, then you are giving a bit of time, but you be very careful that you define that time. Rather than I asked you, can I take a week? But the patient may not ask you, but she may assume that she has a week. So you always say that, why don't I give you some written information, and I can see you again after the clinic, and in the meantime, you can discuss, you can go through the information and discuss with your partner, and then, we need to expedite this. I'm not really happy in sending her home unless she wants to go home, and then I can say, do you want me to see if my consultant is available to have a chit chat with you as well about this. I'm not happy to send her home unless she is very adamant that she wants to go home. If then I will rather call her tomorrow morning, not give her days on this one. Okay. So just be very careful that this baby is 4.8 kilos. Okay. And we may end up, then telling her that now vaginal delivery is not a safe option if she hits that 5 kg mark. Okay, now how would I normally handle this? If I sum all of you up, then I can make a good kind of, I can bake a good response here. Okay, so yes, first of all, when I'm saying that, what's the fuss? I had a baby and, not a problem. So I'll start with Usha's point about appreciation, asking about the baby, and appreciation that, okay, I'm happy that the baby is doing well. At this point, it would be a good idea to ask the name and the gender of the baby, if I haven't already said to you. then you can ask, okay, how is Charlotte doing now? And I can say, yeah, she's lovely, she's fine. And, you know, connection with a name is a very good communication skill, okay? Then after addressing that, I say, I'm very happy that there was no problem in Charlotte's case. But there are two reasons for that, I would say. One is that she was still 4.2 kilos, and here already we have 4.8. Do we have, and now again, because the station started a while ago and we've just started picked from the mid of the station, you would have probably asked, have you named the baby? And if there is a name like, you know, William, so you say, so are you, you see that from the scan, we can see that William has already grown to 4.8 kilos. That's a lot. So we are, you know, we are having a bigger issue here. And not only that, even if it was the same weight, I just want to say that because Charlotte didn't have any problem doesn't really mean that you know, it's safe to continue like that. I would just say that you are very lucky, and Charlotte is lucky that she didn't end up in you know, any bigger issues, bigger problems. But it's not really worth taking the risk again. So even suppose if the weight was almost the same as before, or she said that the weight of Charlotte was also high, that still doesn't mean that you always don't have to, you know, you don't have to have bigger risk factors here. Just say that even if the risk is same, it's just fortunate that she didn't have any problems then, and but still it's not worth taking the risk, because there are so many risks associated with that. You want me to quickly tell you the risks? And she says, yeah, okay, so there's a risk of, you know, further delay in the delivery, injury to the baby, injury to the mom. There's a risk that that William will be, you know, squeezed inside and not able to come out, means affecting the breathing, and not only nerve injury, but, you know, the brain suffers because of no blood supply in that time. So you can imagine all those. And unfortunately, there have been cases where we haven't been able to save the baby. Okay, so you have to sum up everything. You have to focus on her question, as she's saying, so what? So one thing that was very disappointing, when I was asking that, so what? So you guys kept on saying the risk of shoulder dystocia increases, but I'm already saying that, so what if I have shoulder dystocia? But you're saying risk of shoulder dystocia will increase. My question is still there, so what? So you guys are still, you have to quickly jump out of that 10 times high risk of shoulder dystocia. You kept repeating that. You have repeated 10 times so many times that I was like, I would count it as a very poor communication with the patient. Okay, you've said it once, maybe, okay, sometimes, you know, twice would, I don't know whether the twice will be acceptable, but still, sometimes you've said it more than twice. So that kind of repetition is poor communication. Okay, I'm not asking you to tell me that how much is the risk of shoulder dystocia. I'm saying, what's the problem with the shoulder dystocia? You should quickly jump onto not only that we have a high risk of shoulder dystocia, the things that can happen with the shoulder dystocia, they are very risky. We are worried about those. And although you're lucky that you didn't have those before, but these are the things that can happen. Okay, this was what I was asking. You tell me what are the things that can happen. That will include PPH as well. That will include trauma and perineal tears. That was pointed out very well. And all the things that can happen to the baby. Okay. And you have to squeeze all this into 2 to 3 minutes. That's it. You won't have that much time. Patient will have so many more questions. Okay. Is that clear? Do you think it helps in thinking? I think you start thinking in bubbles.
Yes,
okay.
Thank you.
Yes, this is very useful, Dr.
Okay, good. So all I'm saying is that please focus on my particular question. What's happening is you're not coming out of your mind, whatever information from the background, from the past, from the rehearsal of previous stations you have, you're sticking to that 10 times risk and all that. You're not focusing on what my words are. My words are, so what? What's the fuss? shoulder dystocia will happen to me. What's the first? You're still saying you are at increased risk of shoulder dystocia. I want to really get annoyed there. That why are you keeping repeating the same thing? I am not bothered by shoulder dystocia. I had it. I thought it's just a small thing. You know, for me, shoulder dystocia is just a simple thing. Baby's head got, you know, shoulders got stuck. Somebody did change my posture. I delivered the baby. Full stop. Okay. So it's your job to explain why should I be bothered. So you would say that it was good that a little intervention ended up with the safe delivery of the baby. This may not always be the case. Okay. You also need to mention about, you know, some all in one sentence that, you know, that maybe failed delivery, maybe additional very difficult maneuvers and all that, but please come quickly to why the shoulder dystocia is a problem rather than keep repeating that shoulder dystocia risk will be higher here. Okay. So now let's move on to another task. This is not from, in this one, I mentioned that this is not from a station or from an previous exam station, but what I'm trying to assess here is something which is very relevant and crucial to the exam. Okay, so let me share, and I need again a volunteer, and I'd like to start with Hafsa if that's all right. Are you ready, Hafsa? So
yes, I'm ready.
Okay, so can you see the screen? I want to give you 2 minutes to quickly think in bubbles, okay? What are the aspects that you want to address? Think in bubbles. You can write bubbles in front of you. This I want to address, and just make it quick.
Okay. I'm ready.
Okay, so I'm Lisa.
Hi, Lisa. Congratulations on the delivery of your baby.
Thank you, Doctor.
And what's your baby's name? What's his
Sorry, Doctor.
name?
Oh, she's Carla.
Okay. So how are you and Carla doing?
Yes, fine, absolutely. I'm just getting ready to go home. Can I go home, Doctor?
Yes, I'll look through your notes, and if everything is okay, then it will be okay to go. So
yeah, I said everything is okay. She said that you will talk to me before I go home. Everything else is okay.
Okay. So I can see that your weight to height ratio it's on the high side, and there's need for you to work on this weight to height ratio just to improve your health and also improve the outcomes of your next pregnancies. Am I clear?
What was that? Sorry, Doctor, I couldn't hear you.
Okay, I said your weight to height ratio I can see is 43. Yeah, and it shows that it's on the high side. and it will be really beneficial if you work on it for it to improve. Am I clear?
What do I need to improve?
Yes, usually a combination of diet and exercise are used to improve it. And this, I would, if you don't mind, I would want to link you with our exercise specialist and also our dietitian. But this would be after you've weaned off your baby. How are you feeding? How are you feeding Tala now? Hello?
I couldn't hear the last few words, doctor.
In Tala, how do you intend to feed Tala?
I still can't hear you.
Are you breastfeeding Tala? Do you intend?
Yes, doctor. Yes, yeah. It's difficult, but the midwife is trying to help me with that. It's been quite difficult.
Okay. So, is it about the nipple? Is the nipple well attached, or what's the difficulty?
Doctor, there's some attachment problem.
Okay.
So the midwife said that there will be a community midwife who will come home and she can keep helping me with that. So, but otherwise, can I go home?
Yes, you can go home. And I also want to talk to you about contraception.
Contraception, Dr. Okay. Yes, they said that I will be, I have an appointment with with the nurse and the family planning nurse in the clinic. So I'm going there in 3 days.
So what about blood thinning injections?
They have given me some blood thinning injections as well.
Okay, and for how many days did we recommend it? Was it recommended?
I don't remember, doctor.
Okay, so I'll check through your notes and we'll be writing back to your GP about it so that we avoid any risks with blood clotting.
Okay, okay. And okay, sure.
So I'll be linking you to our dietitians and also our exercise specialists so that they work on the weight with you and in such a way that it doesn't also affect the feeding of Tala. Hello?
Okay,
Can you?
yes, thank you.
Thank you.
Thank you, doctor. Okay. Anyone else wants to give it a try as well?
Ma'am? Me, ma'am?
Who is it? Manika?
Manikam. Lisa, yes, ma'am. Lisa, your weight to height ratio is little on the higher side. So you need breastfeeding initiation and it has to be improved. It's difficult in women with higher weight. So after establishing good breastfeeding, you can go home. That is one option. Or otherwise, breastfeeding people, the concerned midwife will come and teach you. One more thing you'll be offered this blood thinners for a period of 10 days. Only this is the high risk. If there are other risks, you'll be offered for a period of 6 weeks if there is any high blood pressure or diabetes.
Okay, doctor.
And one more thing, it is very difficult to reduce weight with the dieting and physiotherapy with this much of a weight. Please don't mistake me. There is another offer. You'll be offered referral to the bariatric surgeon at this weight to height ratio. If you are willing, he'll be explaining the option of undergoing bariatric surgery. That's also an option.
What's that, doctor?
Surgeon, he's a surgeon. He does the keyhole surgery to reduce so that he'll be diverting the bowel so that the absorption will be minimized.
Okay, doctor.
You can think over that, or if you can come after and next visit also, you can have this discussion. It is not an emergency thing. I want to tell you, so that it will be helping you in long run, and even in your next pregnancy, you'll be in a better position in your before pregnancy.
Okay,
This is your
doctor.
first baby.
Yes, doctor. Yes. Okay. Okay. Sure.
Thank you so much.
Thank you,
Do you
doctor.
have,
Thank you. Okay. Anyone else? Quickly.
Can I try?
Me, ma'am.
Usha?
Poonam.
Yes.
Poonam?
Yeah, ma'am.
Usha. Poonam and Usha both wanting to try.
Okay, yeah.
So Poonam, yeah, try first and then Usha.
Okay.
Yeah. Hello, Lisa. Congratulations as a new mom. How are you doing?
Yes, thank you, doctor. I'm good. Thank you.
And how is your recovery after delivery?
Yes, doctor, everything is fine. I weed and bleeding is fine as well. It's just we're trying that the baby starts breastfeeding properly. My midwife is helping me with that. So we are achieving that.
Yeah, good to know. And have you named your baby, Lisa?
Yes, she's Carla.
Yeah, Tyla is doing well. Yeah.
Yes, yeah. Thank you.
Yeah, good to know, Lisa. And Lisa, I don't have any notes with me. I need to know your blood pressure and blood sugar. Was it normal throughout pregnancy?
Yes, yeah, doctor. Everything was normal.
Yeah, good to know. And you have given these contraception advices. What are your thoughts about your future pregnancy, Lisa?
Yeah, I don't want to be pregnant anytime soon. So I have an appointment with the family planning nurse in 3 days. Yeah.
Yeah, good to know. Lisa, a few concerns regarding you. And as pregnancy increases chances of clot formation, and it is further increased by high BMI. Few general measures will be required at the time of discharge, like you hydrate yourself and be as mobile as you can. And you need to have some support at home because being a new mom, you may require some support. Am I clear so far,
Yes,
Lisa?
yeah, I've got good support at home. Thank you.
Yeah, good to know, Lisa. And a few concerns, some blood thinning agents may be required, and for that matter, I'll involve my doctor called hematologist and also my consultant. Some stockings may be advised to you, and blood thinning agents may be required for 10 days, Lisa. They will, I'm assuring you that they will not interfere with the breastfeeding.
Okay.
Am I clear?
No. Okay. Yeah. Thank you, doctor.
Yeah. And anytime you feel swelling feet or any breathing difficulty or any discharge down below and fever, you need to come back to us. That is the emergency. Emergency contact number will be shared with you.
Thank you, doctor. Yeah. Thank you
Yeah.
so much. Yeah. Will do.
Any other concern, Lisa?
No, doctor, you just, if there's anything you want to tell me.
Yeah. Thank you. Thank you, Lisa, for letting me explain these things to you.
Thank you, doctor. Thank you so much. Okay. Very good. Anyone else? Shall we just quickly sum up? Yeah. Usha said. Usha?
Actually, Dr. Poonam covered everything. The one thing, so do I repeat everything or?
Okay, you can carry on from her.
From Dr. Poonam.
Twin you together then. Yeah.
Yeah, because she has covered everything.
Okay.
One thing I just wanted to ask him, yeah, any problem during labor?
Okay, yeah, no problem, doctor.
No problem. That's very good. And may I ask, was it any, did you conceive naturally or did you?
Yes, yeah, doctor.
That's very good.
Yeah.
So yeah, coming to your yeah, it's really good. You have delivered very well, and your have you started breastfeeding?
Yes, I just said that midwife is helping me with the breastfeeding. It hasn't been easy, so yeah, we're reaching there, almost there.
Okay, so the one thing, yeah, I can see because this height weight ratio is higher side, some implication for future health as well. So yeah, if you want, we generally recommend would you like me to explain you what are the future implication on your health?
Yes, sure, please.
Yeah. So like if you want to become next pregnancy, there is a high chances of developing diabetes, sugar, during pregnancy, and high blood pressure. It was good you did not have this kind of symptom in this pregnancy, but they may come up in next pregnancy. So for that, we would like to connect with dietitian and a programmed exercise program. They will explain you how to do it proper way, and they will monitor you. And a healthy diet will always help you. Yeah. So would you like to that one help? And also, until your height to weight ratio come down with healthy, because we before below 30 we expect this is the healthy, right? So next pregnancy we advise not to try till your weight become below this 30.
Okay.
I know it sounds a bit odd, but it's just explaining you because of your health problem.
Okay, doctor.
And yes, enjoy your motherhood.
What would you do now?
Yeah, so now as we will involve, as you are going home and you said you had some problem, so we will write back to your GP. Your GP will come with some in your area, whatever dietitian and exercise program available, they will write, and they will also arrange some community health midwife, nurse come to your house. They will help you. And also, as family planning, because you are breastfeeding, but also sometime if you are not continuously breastfeeding exclusive, 21 days you are okay, but after that you may need so make sure you will have some kind of contraception, reliable contraception. Yeah.
Okay, doctor. Yeah.
Anything else you want to ask? Any question? Yeah. And also blood thinner we will for 6 weeks as your height to weight ratio. Usually I will write to straight away my involve my colleague, blood doctor. Usually they will give you tablet at least 6 weeks according to your.
Is it tablet, doctor?
They will give you tablet because you are going home, or injection. They will come up whatever they.
Okay. Thank you so much. Thanks, Usha. So let's quickly jump. We'll go from the fresh to the previous attempts. Yeah. So this one, first of all, let me clarify this very big thing. Girls, low molecular weight heparin never comes in tablets. Never. Okay. So yes, patient is going home, but she is taught to self-inject.
Okay? That's people, what. Yes. After finish, I thought, oh yeah, she will be taught. Yes, like
we give a pre-filled low molecular weight heparin syringes. She will have to do one syringe each time. Okay, and she will be taught how to inject them. Secondly, please remember that for prescribing low molecular weight heparin, we don't really need any hematologist. Okay.
Okay.
All of you, we don't need hematologist for her for prescribing. Okay, for prescribing. Okay, just for this one, we don't need hematologist for this thing. Yes, we can mention MDT care by we'll look after as an MDT care, or my consultant and hematologist, they will look after you whilst you are in this taking these low molecular weight heparin. Okay, so what happens is that especially hematologists, where does hematologist role comes, where they are really complicated. They were taking low molecular weight heparin before and they have to continue, or they were on warfarin for some reason, they have to they were switched to low molecular weight heparin, and those kind of complicated scenarios. or where there is a high risk of thromboembolism. In those ones, the previous history, or having some thrombophilia, and those there, especially, they will come just for prescribing based on these. We don't really involve hematologists at this point, but we can always say that this will be MDT care is provided by us and by hematology department and all that. That's not a problem. You don't need to ask a hematologist to prescribe her. Just remember that, okay? And what we do is we say that we will prescribe you some injections, some blood thinning injections that will be necessary, and you will be trained to inject yourself, okay? So this is what you will tell, okay? So then you can see whether she is for 6 weeks or 10 days, and then don't start explaining the contraception if I haven't asked you to, but it's okay. You just said that it's 21 days, and that's fine. You can just make sure that I'm going for my appointment. So basically, you did very well. You were actually going to give up, Usha. You said that yes, everything she has asked, and then later on you remembered that you can talk about the high BMI, yeah? Right? Now, every one of you said next pregnancy, before next pregnancy. No, none of you said to me, am I aware of the risks with high BMI? None of you asked me. Yeah? Do you think that should be your starting point then when you're talking about the BMI?
Yeah, in the beginning, I said you did not develop these in this pregnancy, but these high blood sugar and
yes, you said that, and what I'm saying is,
I should elaborate more. Yes.
No, you should check my understanding.
Oh, yes. Okay.
You should check my understanding. What do I know about high BMI? I'm not sure why all of you are singing about high BMI. Well, I don't even know what does it mean. What's the problem? Just like in the previous one, I said that what's the problem with shoulder dystocia? Now I don't know what a high BMI is. I just think that you are too skinny. You don't find too much to eat. So I find good stuff to eat. So I don't know what's the problem with high BMI. So you need to ask me. I see that your BMI is 43. That's your height weight ratio. Are you aware of the implications of this or any risks? Has somebody spoken to you about this? Okay. See? You get the point? So first you check my understanding. Yeah. Then everyone kept saying your BMI is on a higher side. Hafsa said this, you said this. I think everyone said is on the higher side. Now I don't want to hear higher side for BMI above 35. What can you say?
BMI is high. Your weight
is significantly high. I see that your BMI is significantly high. Do you know the implications of this? Yeah. Just speak scientific language, but speak. If you said slightly high, or if you said on higher side, I just pointed it out that you will be making a patient safety mistake. Patient will think my BMI is slightly high, is on the higher side. So what? Why should I care? Okay. Okay, girls.
Very
so
high.
Higher side and slightly higher are very dangerous words because you are giving a very, very incorrect impression to the patient about her health. And it's not only about pregnancy, girls, it's her heart health. None of you said that there's a problem with the heart. Yeah, none of you said that this can have implications on your heart health, on your bone health, on your life. None of you said that, did you? Yeah, you kept thinking about for next pregnancy, next pregnancy, next pregnancy, next pregnancy, next pregnancy. So please remember and take a holistic approach. This patient is going home. She may never want to become pregnant again, but still she needs. I mean, when she hears this, she may go home and say, I think they're saying next pregnancy is very dangerous with this. I'm never gonna get pregnant, full stop. I'm okay with McDonald's, okay? I'll sit on my sofa, enjoy my McDonald's, watch movies, okay? So what you are saying here is that you are saying there are several risks, and you are then saying, do you want me to talk about those? And then you can quickly say there are risks about your heart health or your bone health and whatever you can think of, then you can at least say these two, okay? Risk of venous thromboembolism, you can mention that there is a risk of clots, legs and lungs and all that, okay? And then what I want you to do, okay, about the bariatric surgery, thank you that you brought it up. Who brought it up? It was Manika? Wrote it down, yeah.
Yes, ma'am.
Yeah, Manikam brought it up for the first time. So Manikam, you had a very good point, but what?
I should have explained, ma'am. First
of all, again, you needed to start with, am I aware of my risks? Okay. Yeah. Am I aware of my, why is it important? You haven't told me, you've talked about surgery, but I don't know. And sometimes I may be shy enough that, these doctors, I don't know what they're talking about. Just let me go home, and I may keep nodding on everything. Unless you take the initiative to explain things to me, you check my understanding. That's why we always say that check the understanding of the patient. Sometimes we want to just go home and you say, oh, they have a lot to say. They'll give me anyway in writing. So I'll go home and I'll read. Okay, that's where the importance, significance of writing on the discharge letter becomes so important as well. All the instructions and all the advice that you've given. But yeah, I may be preoccupied with the wanting to go home, with that excitement and all that, and I don't want to listen to you, and you haven't bothered to check my understanding. That's very, kind of dangerous in terms of patient safety. Ask me and then tell me implications not only for obstetrics, just as general health as well. Okay, and then yes, please start with that. You said very well that it may not be possible just with the diet. It may be very difficult target to deal with just with diet and exercise and all that, but we are here to help. And when you're talking about bariatric surgery, offer me a leaflet right there and then. I'll give you something to read about it. Okay, this can be arranged through your GP. Okay, yes, yeah. So absolutely, you see, if we start writing down everything that everybody said, then we do come up with some
bubbles,
almost complete things. But then again, despite those complete things, as I said, nobody told or asked me about the risks, and nobody, what did you not do? What else did I say you didn't do? Outside obstetric health. Okay, so you didn't mention about the heart health and all that with obesity. So this is what I want to point out. I deliberately kept this as a postnatal so that you don't have any other issues going on in your head. You just focus on the obesity. Okay. You all were very good with the contraception. Maybe you picked it from each other as well. Okay, because we need contraception for her, right? Yeah. So yeah, other than that, let me
estrogen, ma'am, estrogen to be avoided in her condition.
You don't need to say this to the patient. She will be she has an appointment with her nurse, and she will look at her BMI. So you don't need to tell her that estrogen needs to be avoided. I would not be telling this to the patient, that estrogen. If you are discussing contraception with her, then yes. Okay, but you're not discussing, isn't it? I'm saying that I have an appointment. Yeah. If you are discussing, then you can say that. And then there's no harm in saying that. I'm not saying there will be a deduction in the marks for saying this, that yes, you will have an appointment with your nurse and she will advise you, most probably advise you not to have estrogen containing contraception. Okay. So you see, you guys miss a lot. I just want to say to you guys that please keep in mind the question, think around the question and think, go bullseye. Have you seen bullseye? Yeah. Where people target practice. Yeah. Start from the center of the bullseye, then go out in circles. So when I say start in the center of the bullseye, means exactly where the problem is. First inquire that, address that, then anything around it, relevant to it, and around it, go out in circles. If you go bullseye way, then you don't really miss important things. Okay, so please focus on. Here the focus was on obesity, and the focus was on how would you tell her that she is obese. Like, and again, please, this is not my official word. I'm just talking to you. So I'm saying obese. How will you tell her that her BMI is significantly high?
higher.
Yeah. So if you find there are people who say that the patient may be very angry and upset and she may not want to hear that her BMI is high. So how to handle that? So I always say that then you say, this is what I told my students for OSCE, that you always say that if you, and actually they used it in the exam and they were so pleased that, you know, it worked for them. So this is a very high BMI lady, and this my student, she asked her, and then she said that, are you aware that your BMI is significantly high? As per national guidance, the BMI can be classified as mildly high or moderately or severely high, and you are actually falling in the category of morbidly high BMI. So this is how she said, so it was all scientific. Okay, now please girls, I have heard people, it's so disappointing to see people, I keep saying this, it's not about my personal feeling against somebody, but I feel really disappointed that thousands of students get misguided because some people think they can teach whilst they passed only by getting, you know, like under 70% marks, and that's not a good idea. And then when they teach, I heard somebody saying, you are talking to a high BMI lady and saying that you look smart. And I have a recording of that mentor saying to the, you know, to the high BMI lady that, no, you look smart. So please avoid these kind of foolish things in the exam. Okay. And try to avoid foolish mentors as well, please. Okay?
Ma'am,
Yeah?
I had an experience, ma'am. I have to write it personally to you. Shall I tell here, ma'am?
It's up to you, Manika. You can
No,
write
ma'am.
to me.
I'll write to you.
If
it's dangerous.
Yeah. Look, our intention is not to belittle anybody, but I will be totally, I am, it's not I will be, I am totally disappointed by women, by doctors who have passed, who struggled to pass their OSCE, honestly struggled. They were like, what can I say? Please give me recalls, kind of people, you know, struggled, and they passed with like 65%, 67%, 68%, these kind of scores. And next day they started teaching. I mean, there should be some sense of responsibility, but again, it's you guys as well. You guys, if you guys keep giving words to, I mean, I understand you want to, all of you, you want to pass and you want to get free help as much as you can, but sweetheart, free help can actually misguide you as well. So only get good free help, not just any free help, okay? Because of course, at the end of the day, they start offering you circuits, okay? Even if not a full course, they start offering you circuits. And tell me honestly, what are you going to get from those circuits other than the misconceptions and wrong words for your exam? And you'll, you know, what will you do in your exam? Okay, so please, please, please try not to follow just anybody's advice. That's very dangerous. You are all there. If you are doctors, I have to imagine that you have a good IQ. Okay, so please try to see that, you know, even we do free courses and then we do paid courses. That doesn't mean that I'm not against anybody's paid course or anybody's free course at all, okay? All I'm saying is people should actually weigh themselves before they start on, you know, embark upon a mission to teach others whilst they themselves hardly passed, hardly. So, I mean, anybody who couldn't even score 75% marks, please just avoid them. Please avoid them. Go over 75. Somebody scored over 75, go. But then I've seen one mentor lying about their scores as well. So yeah, I can't help it, but I just want to say, please try to see, try to understand, try to use your, you know, I don't know, what can you use to figure out that what mentor should be followed. And all I hear is, your voice is so lovely. So what lovely voice is going to, it's not going to get you a pass in your exam. So you guys keep getting, you know, your voice is so lovely, but she didn't pass the exam with a good score. So please, 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 girls, don't follow these advices. Don't say to a high BMI lady that you look smart.